Hey everyone, well, welcome to today's lesson. Today's lesson with Ask Nurse Drea is going to be how to reclaim your pre-pregnancy body. So, what we're basically going to discuss today is the fourth trimester, which is the period post-pregnancy once you've delivered the baby, and then we're going to go into 3 ways that will really help you jumpstart your post-pregnancy weight loss. So, let's get right into today's lesson: how to reclaim your pre-pregnancy body. So, as we go through the lesson, feel free to put any questions or comments in the chat box below, in the comment box, and I will definitely respond to your posts or to your questions. And you can also jump over to my blog post, asknursedrea.com, where we have a whole post about how to reclaim your pre-pregnancy body, a lot more information and ways that you can speak to Nurse Drea directly and ask any questions that you want to ask live directly to me. So, like I said, just head over to asknursedrea.com after the end of this presentation if you have any further questions, or you can just drop a comment below. Now, you'll see me using some slides on the screen as we go through the lesson, but I'm also just going to be kind of glancing here and there at my notes because obviously I can't remember everything about everything all the time. So, I do know a lot about this topic. As everyone knows me, I've been a nurse for, it will be 10 years in 2023, so 9.5 years. And then I was in emergency medical EMS services before that. I have 3 children. So 2 of them I birthed and one of them I was gifted. So I definitely can give you some advice on how to regain your pre-pregnancy body. And for myself, I can actually give you some insight on both aspects of it because I had a child in my 20s and then another child in my later 30s. I'm actually 4 months postpartum and working on regaining my pre-pregnancy body. So, my metabolism isn't the same as it was in my 20s. So definitely be sure to give yourself some grace. It's not always going to look the way we think. It's not always going to be as easy as we think, but we're going to get there. So basically here what you see on my screen is just a little excerpt. It's basically explaining that, some women seem to breeze through this and return really quickly back to their pre-pregnancy state. But for some of us, it's actually a process and it's difficult. So, just give yourself grace, whether you're athletic or not. The stuff that we're going to talk about today is going to be able to help you, from the beginner athletic person or the non-athletic person or the super athletic person. These will help anyone. So here we go. Let's move on with today's lesson. So the first thing I want to do before we start talking about how to lose the pre-pregnancy weight, I do want everyone to get a kind of brief overview of the fourth trimester. The fourth trimester is the period after you've given birth, immediately after birth until we're basically healed from being pregnant, which can happen anywhere from 6 to 8 weeks postpartum. Right around that postpartum visit time is when they kind of clear us to begin exercising. But in those first beginning 6 to 8 weeks, there's a lot of changes happening to our body, and we kind of categorize that as the fourth trimester. So a kind of definition of the fourth trimester is the maternal anatomy and the physiological changes that happen in the pregnant state returning back to their pre-pregnant state or non-pregnant state. This is a critical time during this where you can set the stage for the long-term health, what you're going to be, how healthy you're going to be going forward from the time you were pregnant. So this is critical here to jumpstart this time for health and wellness right after you have the baby. Some changes that you'll definitely see are some vaginal changes. Your vagina and the vaginal canal are going to go back to their pre-pregnancy size and pre-pregnancy state. Some women have had tears and they maybe had to have sutures or repairs to those lacerations or tears during pregnancy. So that's going to determine exactly how quickly and how much your vagina goes back to its normal state. But the body is magical and it definitely goes back to the way that it was before. Obviously, there may be slight variations depending, like I said, if you've had tears or anything like that, the number of children you've had. But for the most part, you're going to go back. The same thing with the uterine changes. Our uterus, we definitely have a lot of pressure on the uterus and on the pelvic floor. So those changes are going to go back. The uterus is going to shrink back down. You're going to feel some contractions even after you've given birth, which is the uterus contracting back down to its size that it was pre-pregnancy. So we do have some things that we were talking about here with the uterine changes. So yeah, like I said, the uterus is one of the most amazing muscles. It actually expands several times its normal size to accommodate the size and weight of the baby. So after birth, it's going to require some contracting back to normal in order to get back to your pre-pregnancy size and state of your uterus. So we're going to be dealing with that during this fourth trimester. And sometimes those contractions can be painful. So before we can get into our workout routines and things, you just have to be mindful of these things so you understand that you're going to be feeling different pains and different things as we go along here and as your body changes back. Vaginal discharge, that's a big one here in the postpartum state, because obviously most people understand that you're going to be bleeding for at least maybe up to 6 or 8 weeks postpartum. So that's going to maybe make working out a little more or less difficult. Obviously, the bleeding should get lighter and lighter as we go along, and the discharge should be getting lighter and lighter as we go along, as we get closer to that 8 week mark. But just keep being mindful of that. If you are working out and you see that the bleeding begins to increase, you may want to slow down the level of intensity of workouts and definitely contact your provider if you notice any significant changes. Urinary problems. This is one that not a lot of people always talk about, but urinary problems definitely occur in the postpartum state because we've had a lot of weight on the pelvic floor and a lot of weight on the bladder. So some people can, one of two things, you can experience urinary retention, which is when you can't urinate or you feel like you have to urinate, but you're not emptying the bladder fully, or urinary incontinence, which is when you are urinating unintentionally, I guess you would say, where you have a hard time holding your urine. And both of those things happen, like I said, from the weight of the pelvic floor and the weight of the baby sitting on those muscles and that bladder for 9 months. And depending on the size and weight of your baby, the number of pregnancies, these conditions can go either way. So this is something you definitely want to discuss with your provider if you're experiencing either one of those at the postpartum visit. Changes to the abdominal wall. So the abdominal wall is made up of some elastin fibers that stretch a lot when we're pregnant. So we have to allow time for those fibers to go back to normal. And sometimes when they rupture, you're not going to get that firmness on the abdominal wall that we've had before and the firmness in those muscles. So sometimes wearing an abdominal binder is helpful to help tighten those muscles and hold all that together. If you've had a C-section, definitely an abdominal binder is helpful to help put some pressure on those abdominal wall and some of those muscles until those elastins kind of heal back together. Diastasis rectus is also a condition that occurs in pregnancy. It's when the abdominal muscles separate. So they're actually going to separate and there'll be a space between the walls of the abdomen and those muscles. And sometimes that requires surgery to repair, sometimes physical therapy, and sometimes, just time and strengthening and core strengthening. We're going to do a lot of talk later on in the video about core strengthening exercises to help pull all that back together. Your blood volume. So when you're pregnant, your blood volume has to increase in order to supply blood and oxygen to yourself and the baby, because our blood systems are kind of intertwined at the time. Like our blood doesn't pass through the baby, but we have to supply oxygenated blood to the baby. So your heart's going to beat faster. You're going to produce more volume of blood and more fluid while you're pregnant. So once you have the baby, now we have to release some of this excess fluid. So a lot of that is going to be through urine. You're going to urinate a lot more after you have the baby. Sometimes perspiration, so you're going to be sweating a lot more, and lots of different things that are going to help release some of this excess fluid that we lose a lot of the fluid obviously during birth, the amniotic fluid and some excess fluid, but sometimes there's still more to go. So we have to let the blood volume and our fluid volume also return back to normal. Now, just a side note, if you don't notice that and you notice fluid retention where you're swelling or anything postpartum, you definitely want to contact your provider, because those things could be a sign of preeclampsia or postpartum hypertension. So definitely make note of that if you see swelling or extra fluid retention after pregnancy. And then changes to the breast. Now, most people experience what they call engorgement, which is the flooding of the breast milk into the breast ducts, the milk ducts after pregnancy. So that's going to change the structure of our breast, and that's going to be, sometimes engorgement can be very painful. If you decide to breastfeed, you're going to go through those changes, trying to breastfeed with relieving some of that engorgement and the baby latching and drinking. And if you don't breastfeed, then your breast will eventually return back to normal size, maybe not normal shape, depending on the amount of engorgement and if or when you breastfeed. Okay, so the next thing, like I said in step 1, is to consider your eating habits. during this time you do have like a tendency to indulge your cravings during your pregnancy. So for me anyway, I had a lot of cravings. I don't know if I'm allowed to say like name brands on YouTube or on the camera, but I loved going to Jersey Mike's sandwiches every single day. Now I know I'm a nurse, and they tell you to avoid lunch meat and processed meats and nitrates and all those things, but I was loving the Jersey Mike sandwiches. I definitely tried to keep it to a minimum because I know better, but it was so good and I craved it so much. So, besides the sodium in that and the bread and the carbohydrates and simple carbs and everything that I shouldn't have had, now that I'm in my post pregnancy time in my fourth trimester, I am trying my best to avoid those negative foods. I loved them. I loved bubble tea. I loved all kinds of things that I don't need to eat anymore. So I'm avoiding them as much as possible. Now, obviously, you don't want to deprive yourself completely. You definitely have to give in occasionally, have a cheat day, but I'm trying to get myself on a healthier routine going forward. Like I said, I'm about 14 or 15 weeks postpartum right now. So my baby will be approaching the 4 month mark, and I'm still 6 pounds over my pre pregnancy weight. And I would like to lose them, at least 2 or 3 of that 6 pounds, over the next few weeks or months, however long it takes, but I'm working on it. So I'm definitely trying to reduce my cravings, not indulge in those things so much. Um, I never say make like drastic changes. You want to make changes that are sustainable, achievable, measurable. We're going to talk about the SMART goal setting system at the end of the video, but definitely don't just try to say, oh my God, I'm going vegan or I'm doing something super drastic that you may not be able to stick to. Slowly integrate these healthier changes into your diet and into your lifestyle so that it becomes a lifestyle change and not just a diet or a fad or a quick fix and then you're back to negative eating habits. So you definitely want to have whole grains, more complex carbohydrates, so whole grains, brown rice, whole grain bread. You want to incorporate as many fruits and vegetables as possible into your diet, fresh fruits, fresh vegetables as much as possible, and you want to increase your level of protein. These things are all good for your health and also for if you're breastfeeding, you need nutrients, vitamins, and a certain level of calories. You need an increase in calories to produce more breast milk. So we definitely want to do that. And protein is going to help you stay full longer. So we want to try to just well-rounded, more balanced meals. Definitely, there'll be more videos to come on meal planning, prepping, more healthy meals, more diet. But we're just giving an overview here of things that you need to start doing in this postpartum period in order to regain that pre-pregnancy body. So we definitely want to minimize the cravings and introduce more healthier whole grains and protein options into our diet. We want to drink lots of water. Water is very, very important to stay hydrated for yourself and baby. You're recovering, your body needs extra water. If you're breastfeeding, you definitely get dehydrated a lot quicker, so you definitely want to drink lots and lots of water. Um, Besides just drinking more water, you want to cut out those sugary sodas and sugary drinks, juices, anything like that, any added sugars into drinks and juices, you want to cut that out because those things are just liquid carbs and liquid, like added calories for pretty much no reason. So if you do want something with flavor, add lemon or orange or some type of citrus fruit to your drinks. You can do any type fruit infused water. You can also do some 0 calorie, zero sugar, artificial sweetener type drinks.
Step two in regaining your pre pregnancy body is include exercise into your daily routine. Now, I didn't say have some extreme exercise workout plan or anything like that. I'm just saying include some type of exercise and movement into your daily routine. I am the queen and I am the biggest advocate of just get moving in any way possible. Park a little farther in the parking lot when you have to go to a store, walk a few extra steps, take the stairs instead of the elevator, just get some extra steps in, extra movement as much as possible. Especially now, I'm recording this during 2022, but over 2020, 2021, 2022, we've been kind of in this pandemic. A lot more people are working from home where you can't necessarily, you're not going to be moving, you're not going to the office, you're not necessarily getting in the car or taking the bus, train, plane, whatever it is that you do. So it's better to, if you can in any way, just get movement into your day as much as possible. I take my baby, I'm still on maternity leave, so I take my baby for walks. I push the stroller. If you can, join mom groups or dad groups if it's a dad watching this, but more than likely not. And, because this is pre pregnancy body, luckily they didn't have to deal with the pre pregnancy body, but some guys do gain the sympathy weight, they call it. So if it's a dad watching this, babies for walks, push the stroller, anything that you could do to incorporate movement into your daily routine. Once you get a routine of just getting more movement into the routine, then you can start on beginning with some low impact aerobic exercises, 20 to 30 minutes a day, gradually adding in more time. You can add it in 5 or 10 minute increments and move it up as much as we can. Sorry, guys, I'm just going to grab my baby over here. Come on. You're going to be on the camera today. Here she is. This is Miss Ariah, who is 15 weeks old, and she's going to close out this video with us. So yeah, so we definitely want to just incorporate movement into our diet as much as possible. I mean, into our daily routine as much as possible. And then we also want to start doing 10 minutes a day of abdominal or core strengthening exercises. That could be sit ups, crunches, planks. Kegels are really good for the pelvic floor to strengthen the pelvic floor. So anything that's going to strengthen the muscles around the abdomen and pelvis is crucial because those muscles were weakened during pregnancy and carrying these wonderful little ones that we have. So we definitely want to do things that are going to strengthen that. And you start with 10 minutes of that a day. You can leave it at 10 minutes or you can increase that little by little as you go along. If you were very athletic pre-pregnancy, you can be and you stayed athletic pretty much during your pregnancy, you could continue to be very athletic. But this is kind of like the beginner plan of just where to start. Start just adding movement. Once you've added the movement, then you can go into some type of more low impact aerobics or cardio and then just increase from there. Don't stress yourself out. That is number one, because if you stress yourself out, you'll stop altogether. And that's not what we want to do. We want to keep doing something. Pre pregnancy, I didn't have a say workout routine, but I'm definitely an advocate of walking. I used to walk 5 to 10 miles almost every day, or at least 3 to 5 times a week. And I tried to keep that up through my pregnancy. I think I did it up until about my 8th month. um, and then I mean, I hiked a mountain, Mount Momont in Paris, 8 months pregnant. So I went in January for New Year's, and I had her February 7th, and I hiked up a Momont, which is like some kind of really steep mountainous hill in Paris. So you can do it. You definitely can do it. Now it wasn't easy. It wasn't, but I walked and worked out throughout pretty much my whole pregnancy, at least walked and did low impact exercise. So for me, I just continued it as I went along. Okay, baby. You're gonna get on the camera and they're gonna see you crying. You want to have this? Here. Okay. Okay. We're almost done. Step 3 is to set realistic goals. If I can't stress anything, I know I say that for everything, but this is really, really important. You want to set realistic goals, because if you start setting goals that are unrealistic, you're never going to achieve them. You want to set things that are realistic because you want to be able to stick to them. It's better to do 5 minutes a day and just start off very minimal than just do nothing. I have a quote over here that I really love. It says, "When I courageously take action towards my goals, I create powerful results in my life. My next level of success starts now." So just start now as number one. I tagged a little book here. It's called The 90-Day Goals Journey. I'm actually going to put the link below in the description box. That book is going to allow you to write out your goals. They say you have like a 70% more chance of achieving your goals if you write it down. Don't quote me on that. I don't remember the percentage, but I think it was 70% higher success rate if you write it down. So this is a journal that kind of walks you step by step through what you want to do and gives you just a 90-day work, like a structure for the first 90 days, because once you do it 90 days, you'll start to create a habit, and once you create a habit, you'll be able to continue that long-term success. So don't try to do too much at once. There's no one size fits all. Everybody's body is different. Everybody's starting point was different. Everybody's pregnancy was different. So don't say, "Oh, well, my friend lost 20 pounds and this would only gain 5 pounds." It doesn't matter. Start where you are, meet yourself where you are, give yourself grace. Even if you completely let yourself grow, gain 200 pounds. So what? Start there and work from there. There's no one size fits all. There's no one size answer. These are just steps that will help you try to get there, but it's not a one size fits all. Make small changes. Small changes make big progress. Like I said, one of my biggest things that I tell people to start with doing is just add extra steps into your daily routine. You're not doing anything different, just adding a little bit of extra steps instead of, you know, going up the stairs instead of taking the elevator, or just walking a few, park your car a little bit further. Anything that you can do, go and get the mail, but go around the block first to get the mail, or whatever it is that you can do, just add a few extra steps while you're walking around the house. Get a standing desk, start cleaning. If you can clean around your house, that keeps you moving a little bit more. Take walks, just anywhere you can, make small changes, which will eventually add up to big progress. Follow a goal setting strategy. My next slide is going to talk about the SMART goal system, but before that, just writing down your goals, like I said, using a system, something that's going to help you stay focused, stay on track, something to hold yourself accountable, and something attainable. And this is the SMART goal system. This is an excerpt from the book that I recommended, that 90-day goal setting journal. Like I said, I'm going to link that below. Every moment is a chance to choose progress over resistance. And that's it. Just choose progress. Just try to get somewhere, do a little bit more than you did the day before, stay focused, stay encouraged, join the Ask Nurse Drea system and support team. We host free virtual support groups every Tuesday. You can head over to asknursestraya.com, find a support group that will fit your lifestyle and your situation, and they're free. You can talk to other people in the same situation as you, working on the same goals and the same challenges, and they can give you advice, support, accountability, whatever you need. So you want to use the SMART system. SMART is SMART. That stands for specify. So specify exactly what you're trying to accomplish. I'm trying to lose 10 pounds. You want to put a specific, don't just say lose weight. No, I want to lose 10 pounds. I want to lose 100 pounds. And then you want to make it measurable. You want to do it by a certain time. So you want to put a timestamp on it. You want to say, okay, I want to lose 10 pounds by July 1st, 2024, and then you have a goal. Make it attainable. Now, if you gain 200 pounds, is it attainable to lose 200 pounds in a week? Absolutely not. So you want to space that out. It is attainable to lose 3 pounds in a week, maybe, potentially, or 10 pounds in a month. You don't want to make it something that you can't stick to, because then you'll get discouraged and then you'll quit. And then you want to make sure it has relevance. Don't set goals, your specific goal to lose weight, but you're putting stuff in there that is not relevant to losing weight. You want to make sure that the goals are relevant to what you're specifically trying to accomplish.
Okay, so here's some tips for success in the postpartum visit. Um, One thing is to definitely start walking. Walking is one of the easiest low impact exercises that you can do. It's helpful for you to relieve stress, exercise, heart health. Like, there's really no negative benefits to walking. It reduces the risk of blood clots in the postpartum period, especially if you've had a surgery, if you had a C-section. So that's definitely a number one thing to do. As soon as you're able to walk, it doesn't have to be a long time, it doesn't have to be a lot, but definitely just get up and walk as much as you can. Ice packs. Even if most people use ice packs, if you've had a vaginal delivery, they'll put ice packs in the perineal area. But even if you've had a C-section, there's just been a lot of trauma to the bladder, the uterus, the pelvis, the pelvic floor, the vaginal floor, even if you've had a C-section. So ice packs definitely help in the perineal area. You can put ice packs on the abdomen. All of those things are very helpful in the fourth trimester to get your body back to normal as soon as possible, reduce swelling, reduce pain, and less swelling, less pain, the more active you'll want to be. And being active as soon as possible, or as soon as you're feeling up to it, even if it's a little bit of activity, is best. Watch for the postpartum blues and postpartum depression. Postpartum blues usually last about 2 to 10 days after birth, and you're just a little sad or a little not yourself. And then postpartum depression can actually go a little longer if you're starting to feel symptoms of depression, anxiety, any of those symptoms. I would suggest everybody look up the symptoms of postpartum depression, because we're not going to get into it in this video. But it's really important to understand that. And if you are experiencing any of those things, contact your provider immediately and definitely get help with that, because we don't want anyone to suffer in silence. When you go to your postpartum visit, a lot of people aren't really sure what to ask, or what should be discussed at the postpartum visit. So during this time is one of the times to discuss a lot of these things we discussed about this fourth trimester, and also a few others that I'm about to explain now. So if you want to just take a little list, if you haven't yet went to your postpartum visit, these are some great things to bring up. So one of them is contraception and birth planning. According to ACOG, the American Academy of Gynecology and Obstetrics, they recommend 18 to 24 months in between pregnancies. So if you plan on following that recommendation and you want to use some type of contraception, this is the time to discuss that with your provider at the postpartum visit. They also, at your postpartum visit, if you are breastfeeding, I would always just say discuss with your provider the types of contraception. So sometimes contraceptions that include estrogen will sometimes lessen the milk production. So if you are breastfeeding, you want to try to avoid contraception that has estrogen, because it will kind of reduce your milk production. So that's something you want to bring up with your provider at the postpartum visit. Um, some other things to talk to your provider about is the physical therapy aspect. If you do have a lot of problems with the diastasis rectus of the abdomen or pelvic floor weakness, there's pelvic floor therapy that can help tighten those muscles of the pelvic floor to help reduce that urinary incontinence and different other problems, intimacy problems, and any kind of pain you're having. So physical therapy for pelvic floor is definitely a good one if you are experiencing any of those things. Intimacy is something that, usually after that 6 to 8 week mark, the provider will clear you to go back to having sexual intercourse. And during that time, you do want to discuss the intimacy with your provider. Due to the lower levels of estrogen in this fourth trimester, sometimes the vaginal wall is thinner, could make intimacy a little more painful. So that's something you want to discuss. And as we said before, your mental health, if you're experiencing any postpartum depression or anxiety, any type of postpartum mood disorders, you want to discuss those with your provider at that postpartum visit. So now that we've went
So that's all really we have for today. I just want to let you guys know to stay encouraged, keep doing what you're doing. This postpartum journey is a process, it's a journey, it's a marathon, not a sprint. So stay focused. Head over to nursedrea.com for some more encouragement, some more information, more reading on the topic. And like I said, we have free support groups that run every Tuesday. So anywhere you are in the world, you can jump on those support groups. They are free to anyone who wants to join. I might hit the link of that in the description below, or you can find them on asknursedrea.com. And I'll see you guys all in the next video.